And back home, the Parliamentary Health Committee says it will put the government to account for funds to buy the Covid-19 vaccines. Earlier today, my colleague Brenda Zeda Radido spoke to committee member and Seme legislator Dr. James Nyikal on the country's planned acquisition and rollout of the Covid-19 vaccine. Let's listen in.
I won't go for a large order. I would go for an order and checking what is going on, so that if I need to change, then I change. You don't get to a situation like South Africa where they are actually trying to get it to other countries. But the WHO advice is important. In all these cases, you have to say, if I go this direction, what are my dangers? If I go this direction, what are my dangers? Then you take the danger, the least danger for you at that time. And I think at this point in time, the AstraZeneca may still be more useful than going for the ones which will have to have a new cold chain completely. The cold chain vaccine that we have is taking care of a population of children that are born every year, which is somewhere between maybe 1.5 or just above 1.5 million every year, which means we must now start thinking that we will have to expand the cold chain system as we have it now. And it is not only the cold chain system you expand, you will also need more health workers. You could get away if you had a health workforce that was stable and not having strike like we have. You could stretch them to actually do more work, but definitely you will need more people. When we are going into phase 2, as they are saying, where they are looking over something like 9.7 million people, that will be almost nearly 8 times what we require now. More people will be needed, more infrastructure will be needed, and even more supplies. You know, vaccines come with syringes, cotton swabs, all the things that you need to actually do the vaccine. It's not just the vaccine in the bottle itself. The continent has been lucky that the disease is not as killing people as much as in other countries, but we can't go on that luck only. So that preparation and the need for the money is there. We are just starting the budget process. I think this parliament has just opened this week, and we are going to get the budget policy statement. I assume that in that budget policy statement, the ministry has taken into consideration all these phases that they're planning to do the vaccinations and the requirements that they have. I can assure you that from the health committee, we will take this as a priority, because if we don't protect people, then actually we'll spend more when they are sick, whether we like it or not, apart from the fact that people are dying. And they are targeting 40%, but really you would have gone for 70%, because if you want herd immunity, then by the time 70% of the people are vaccinated, you are almost now safe. But maybe 40% is a good target at this point. The information system that is in place that will work along with this, so that we are getting information of how many people are infected and how many people are getting sick. What we expect that is when the vaccination start, we should expect these numbers to drop with time. So that health information must now take into consideration that they are now looking for people who have been vaccinated and whether they get sick. So that when you get sick, the questions you will be asked will be, were you vaccinated? Now, if we start getting people who are vaccinated getting sick, then that's a dangerous issue. But those numbers will be important even to know the efficacy of the vaccine and our efficiency in doing it. At the same time, we have research institutions like Cambridge. I think they must by now put in place research questions and research systems that are going to monitor that as a country, as we give the vaccines, what is happening. There must be epidemiologists that are doing community research, that are doing epidemiology, that are doing public health surveys, so that we know. That is what we need. It is not just that the ministry giving the vaccines and staying there. There must be the information system, the research institutions, even the University of Nairobi, the Public Health Department, and other universities with public health can actually chip in and start getting this information to know how the vaccines are how effective they are. And in the situation where we know that in some countries, like South Africa, there's a variant where the vaccine may not be effective, we should even be more alert that first of all, we check, are those variants in the country? And if people are getting vaccines, how are they responding to the vaccines? This is a new situation, but I think we have the systems. If we apply the systems and put more emphasis, and on our part, probably as Parliament, actually budget in more money to look at the COVID, then I think the country should be able to contain it. The problem is, you know, our financial situation in the country. I know these vaccines, we are going to put more money in it. There shouldn't be people there who are out purely to make profit, sometimes not even profit, to steal, because then it will be impossible. We have seen this when we are talking of COVID, and we had the PPEs and all the things we needed for the prevention. What happened at KEMSA? Please, we'll tell those people in business, people in government, that this is not the time to look for wealth. This is the time to look at the well-being of the country. Obviously, as a health committee, we actually must be now on the lookout. We saw what happened, and I think what I will propose when we get to the committee is that we actually get very frequent briefing on the expenditure that is relating to the vaccinations program that is coming. In fact, you indicated that we expected the vaccines to come earlier and that they may get late. Even that, we are now actually to call for from briefing from the Ministry of Health to know exactly when are the vaccines coming, exactly when are we starting, what are the programs. And then we'll also put at the same time, want to know the expenditure, the procurement system that is going on. I think even the national, the Kenya National Audit Department must also be on this. Audits are not only after the events, but we should even have preemptive audits and preventive audits, so that we know we have been beaten, we should be twice shy.
Senior Legislator Dr. James Nyikal, also a member of the National Assembly Health Committee. Now to our images of the day, where the high above Jerusalem's narrow medieval alleys